first take a look at your back. One. This is point 2. Okay, this is 3. And this is the 4th point. 5th and 6th. 1, 2. Good. Hi, I'm Dr. Matt. I'm going to do your chiropractic assessment. Go ahead and tell me what brings you in today.
Yeah, I'm having a lot of back pain and some neck pain and some shoulder pain. And the back pain is mostly my lower back.
Okay, that's a lot of back pain. For how long have you been having this?
Probably 3 or 4 months now.
Okay. And on a scale of 0 to 10, how would you rate your pain?
Like an 8 or 9.
Okay. Is it sharp? Is it dull? Is it achy?
It's sharp and achy.
Okay. Do you remember doing something in particular that could have caused this?
Not specifically.
Okay. And did it start slow, or you just woke up one day
It's just
having
been
this pain?
gradual.
Okay.
I just finally had to come see you because it's a lot.
Okay. Have you had any x-ray done or CT scans?
No, I'm not.
Okay. And are you experiencing any pain when you move your neck?
I am, yeah.
Okay. Is the pain going up to the head as well, or it just stays in the neck and shoulders?
It's in my head as well.
Are you taking any medications on a daily basis?
Yeah, lots of ibuprofen.
Okay. And did you have any car accidents, any injuries?
When I was younger,
Okay. Tell me more about it.
we rear-ended someone and it was pretty bad.
Did you have any car accidents or any injuries that could relate to the back pain?
When I was younger, I was in a car accident, but it wasn't super severe. And
Did you injure your head?
I think yes, I think there was a moment where I had like a whiplash kind of thing.
Okay.
I thought I'd recovered, but
That's really important information. It could help with the diagnosis and for us to know exactly what kind of treatment to do.
okay.
And okay, I'm going to take a look at your back. So what we do is to see how your spine moves. So we check for spine mobility, and according to that, we adjust the parts, only the parts that need to be more mobile, so that it allows for a better circulation and more nutrient delivery to your spine. I'm going to first take a look at your back, and we're going to check your shoulders, your cervical spine. All right, I'm going to have you face the wall for me. I'm going to put your hair up, and I'll take a look at your neck. Some range and motion test to see for any hyper or hypoflexibility. So slowly I'm just going to palpate right here. Okay, definitely on the left side. There is an obstruction. Just putting pressure on some of the main points that, if they're tender or swollen in any way, definitely could indicate which part of the spine we need to adjust. So there is a region right here in the back of the neck and head that has 6 points. 1, 2, 3, 4, 5, 6. And these points correspond to main organs that are responsible for the balance, homeostasis of the body. Okay, so I'm just going to gently press on each point. Go ahead and tell me if you feel 1, 2, or 3 tenderness or pain.
1. 1.
Okay, this is point 2.
2.
Okay, let me go ahead and find 3. Okay, this is 3.
2.
So that is the neurological part of your system. And right here we have digestive, which, are you having any heartburn?
I am, yeah.
Okay. Let's go ahead and check the other side. And this is the 4th point.
1.
Okay. 5th.
2.
And 6th.
3.
Okay. So the 3rd one is the reproductive part, which could indicate an hormonal imbalance. Any issues with your period lately? Was it irregular, more or less?
It has been a little irregular.
Just going to slowly move your head to the left. Let me know if you feel any pain. 0, 1, 2, or 3 pain.
1.
Okay.
2.
Okay. Just going to slowly apply some pressure here. Go ahead and move up. Any pain?
1.
Okay. Go ahead and try to touch your chin with your chest. Any pain?
2.
Okay. Come back to center. Let's take a look at your thoracic and the last cervicals. I'm going to palpate your scapula and around it. We're looking for any fibrous tissue that has been building up. That usually tells how mobile your scapula and shoulder blade is. I'm gonna have you try to touch with your left hand right here where I'm pressing. Good. I'm going to gently push down on your palm. Go ahead and tell me if you feel any pain.
1.
Okay. What about if I press now here? Do you feel the same amount of pain, less or more?
More.
More. Okay, go ahead and relax. Let's do the same thing on the other side. Okay. Go ahead and tell me 1, 2, or 3 for pain.
1.
Now I'm just going to find the exact point here. Go ahead and tell me if it's the same, more, or less.
The same.
Okay. Just palpating around the shoulder joint. We're trying to compare. This is definitely the one that is kind of underdeveloped, I would say. You're using it less and you're using your left side a little bit more, compensating for the right. And that's what is causing the strain in your back. I'm not feeling any broken ligaments. Going to do a few tests here, so just relax your shoulders. Relax your arm. Okay, go ahead and relax. Okay. We're just doing a few nervous scope tests to check for any nerve impulses that are delivered abnormally. Do you feel this the same as this?
They're slightly different.
And do you feel this the same as this?
Yes.
Feel this the same as this?
Yes.
Okay, just going to slowly palpate the occipital bones. It definitely feels softer than I thought. Just a good indication of good circulation. We're just going to do a little bit of work so that we can boost those nutrients that are transported to these muscles right here, that you have a better support for the muscles. I'm going to use an anti-inflammatory oil. Is it okay if I lower the strap on the side? Go ahead and turn your head this way. So basically we are focusing on the trapezius, on the sternocleidomastoid muscle. I'm just going to use my knuckles first. Then we're going to go in with cold therapy to release some of that inflammation. And once we soften this tissue, we can do a cervical neck adjustment to really increase the spine mobility. Slowly increasing the pressure we're putting a lot of pressure here on the occipital bone. Master it. This is going to help to break those tissues that started to form and they're not letting blood flow go through. This is going to feel a little bit cold. Really focusing on that trapezius, which is definitely connected to your shoulder. Okay, let's go ahead and turn on the other side. This definitely feels a little bit tighter. ahead and take a feel and see how this feels. This definitely feels a lot better. Go ahead and take a deep breath in through your nose and out through your mouth. And again, breathe in and breathe out. Let's go on and work on your arms and legs. Okay, go ahead and relax. Just going to apply pressure on the ligaments that are connected to the trapezius so that we create a bridge in between and we're able to create more space. Go ahead and take a deep breath in through your nose and exhale. Good. Go ahead and breathe in and breathe out. Good. Let's go ahead and work on your wrist. Now I'm going to adjust your hips. So for this part, I'm going to have you give yourself a hug. Perfect. Go ahead and flip on your right hip. That's good. Bend this. Perfect. Take a deep breath in and breathe out. Good. Okay. Now go ahead and switch on the other side. Okay. Take a deep breath in through your nose and out through your mouth. Good. And let's go ahead and take a look at your legs. They're pretty equal, which is great. The hip adjustment definitely helped. Let's go ahead and elongate each leg. Make sure that we are creating that space needed to increase mobility. Take a deep breath in for me and breathe out. Good. And again, breathe in and breathe out. Okay. I'm gonna have you flip on your tummy now and we'll take a look at your spine and back. Just going to palpate lumbar and cervical in the same time. Looking for the coordination in between the two ends. going to test neurological impulses moving from the lumbar area. And that's exactly where we're going to create a micro movement so that we increase your spine mobility. The whole idea is that we want to do minimal work. No unnecessary adjustments that could trigger other disorders or issues in the body. Okay, that definitely feels better. Just going to verify with the heat disturbances, see if there is the same amount of change. So we definitely surpassed that. Right above it, there's one more point. Let's take a look at cervical. Cervical spine looks better. There's just one point here. That's actually T1 and T2. We need to adjust. T6. Applying gentle cupping therapy. This helps to remove toxins that have accumulated near the paraspinal muscles, right where we have the thoracic. It's going to help to relieve that inflammation. do a little bit of skin pulling. Okay, go ahead and take a deep breath in through your nose and out through your mouth. And one more time, breathe in and breathe out. Good. Just going to work on this shoulder as well. Go ahead and relax the shoulder blade. Relax the elbow. Take a deep breath in through your nose and out through your mouth. Good. Same thing, go ahead and take another deep breath in through your nose and out through your mouth. Okay, good. Okay, I'm going to do acupressure. It's going to help to release that tension. Going to apply gentle acupressure also on the earlobe. It does help to relieve tension, stress, and anxiety, and regulate the nervous system. Go ahead and turn your head the other way. The vagus nerve is going right through the earlobe. When we activate it, it does help to regulate the nervous system, decrease the fight or flight response of your body, and also makes the body more responsive to the treatment. gonna have you get dressed and we'll talk about what we should do in the next 2 weeks for your treatment, okay? Okay, Emma, how are you feeling?
Much better. Pain-free almost.
Okay. Well, you're gonna feel a little bit sore when you get home just because we did a lot of movement in the ligaments and muscle joints. And I'll just have you take a little bit of ibuprofen when you take home, drink lots of fluids and rest. And tomorrow morning, let me know, call us and let us know how you're feeling.
Okay.
And if needed, we can have you come back for some more cold therapy. We can do cold plunges, and we can do red light therapy, something to really boost that circulation and help with the pain.
Okay.
All right.
Thank you so much.
You're welcome. It was nice to see you.
You too.